Stomach 4 is located 4 fen lateral to the corner of the mouth. It's in the nasolabial groove. Have the person smile and you can see this point falls nicely into that groove. Do 25 is on the anterior midline at the very tip of the nose. Stomach 1 is located inferior to a pupil looking directly forwards in a depression between the eyeball and the infraorbital ridge. So to locate this point you need to actually stand in front of the person, have them look towards you and mark your point in a depression between the bone and the eyeball itself. Bladder 1 is located 1 fen medial and superior to the inner canthus of the eye. If a person scrunches up their eyes, a nice depression forms here, and that's where you're going to find bladder 1. Gallbladder 14 is located above the pupil looking directly forwards, 1 cun superior to the eyebrow. To locate this point you need to stand directly in front of the person, have them look forwards. Remember the distance from the centre of the glabella to the anterior hairline is 3 cun, which would enable you to calculate your 1 cun. You can locate this point in a dip that's formed when the brow starts to come away from the skull. Do 17 is on the posterior midline. It's 1/4 of the distance between do 16 and do 20. Do 17 is 1.5 cun superior to do 16, but more importantly, it's in a nice depression at the superior border of the external occipital protuberance. Do 20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do 20 is located 1 cun posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back which are other do points, so don't be tempted to go further back than 1 cun posterior to that midpoint. Do 23 is located on the anterior midline, 1 cun posterior to the anterior hairline. We take the distance between the centre of the glabella and the anterior hairline as being 3 cun, so divide this into 3 to get your 1 cun to move back to locate do 23. Bladder 4 is located 1/2 cun into the anterior hairline, 1/3 of the distance from do 24 to stomach 8. Bladder 4. Bladder 8 is located 5.5 cun into the anterior hairline, 1.5 cun lateral to the midline. The easiest way to find bladder 8 is to find bladder 7 and then move posteriorly by 1.5 cun. Bladder Bladder 9 is located 1.3 cm lateral to do 17. Remember that it's 4.5 cm from the posterior midline to the mastoid process, and use this to help work out your 1.3 cm to find bladder 9. Stomach 8 is located directly superior to stomach 6 and stomach 7. So run your finger up in a line from stomach 6 and stomach 7, projecting up onto the corner of the head until you're in a nice depression just superior to the temporalis muscle. Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7, use the medial border of the spine of scapula to dictate your 3 cm mark, move out 2 cm to find this point.
Pericardium 2 is 2 cm inferior to the anterior axillary crease, in between the two heads of biceps brachii. If you pinch the muscle up either side and put your finger in between the two heads, that will be where pericardium 2 is. Large intestine 2 is on the radial aspect of the index finger. It's just distal to the second metacarpal joint. It's much better to locate this point with the fingers loosely flexed. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle.
Large intestine points are best located with the arm resting against the abdomen. Large intestine 6 is 3 cm proximal to large intestine 5 on a line going to large intestine 11. What's important about finding this point is that if you think of the arm as being a box, large intestine 5 would be on the top of the box, large intestine 7 would be on the side of the box, but large intestine 6 would be on the corner. Small intestine 4 is on the ulnar aspect of the hand in this nice depression between the base of the fifth metacarpal and the triquetral bone, which is this palpable bone on the ulnar aspect of the wrist. Small intestine 6 is located in a groove in the high point of the styloid process of the ulna. To find this groove, rotate the arm up onto the body. When you do this, you'll find that a tendon moves out of the way to reveal a nice groove in the bone. Be careful not to come too far radial or you will come off the bone completely. Actually find this point level with the high point of the styloid process, but in that groove. Gallbladder 37 is located 5 cm superior to the prominence of the lateral malleolus at the anterior border of the fibula. If you're finding it difficult palpating the anterior border of the fibula, raise the patient's leg very slightly so that the flesh can drop away from the bone. This should make it easy to find your point.